Welcome to this press conference and national update with respect to our management of our COVID threat. You will remember last time we met, I indicated that we would, in the response to some additional numbers of confirmations of infected persons in the national population, that we would look at it, examine it, use this data to make any responses and any adjustments as required going forward. I did ask that you be patient and we not panic, but we look at it into this week, and in the early part of the week we'll look at it and make a decision as to what we do, and we're at that position today, at that point. So today I would ask the Health Department, CMO, to give us the update so we'll know against what background we are making the decisions that we are making. Thank you, Dr. Parison.
Okay. Honorable Prime Minister, honorable ministers, members of the media, members of the viewing and listening public. The status update for today, Wednesday, 5th of August, 2020, is as follows. So the total number of tests done in the public sector, UE and CAFA, 9,090. Total number of unique patient tests conducted, 7,404. Total number of repeated tests, 1,586. Total number of community tests now stand at 4,584. The total number of private sector tests week ending the 31st of July are now 2,007, with a total number of public and private sector tests together, 11,097. Our total number of positives now stand at 197. We would have received two primary contacts of cases yesterday around midday, and thereafter we would have received 3 new cases which are pending epidemiological update very late last night, so we reported it in our 10 o'clock update. In terms of total number of discharges, we're now at 135. Number of deaths remain at 8, and there are a total of 51 persons in hospital. 40 of those individuals are housed at the Cora facility, and 11 persons at the Couva Medical and Multi-Training Facility. They are all clinically stable, the majority of them doing very well. There are none in HD or in ICU at this time. In terms of our parallel healthcare system, there's a total of 345 individuals spread across various institutions. Starting at the Arima General Hospital, we have some suspect cases. We have 2 persons. At the Cora Hospital, we have 4 persons. At the Couva Medical and Multi-Training Facility, there are 2 individuals. UE St. Augustine Bay Penal Campus, we have 1. At the Chancellor Hotel, there are 14 persons. At the Napa, where we have our healthcare workers, there are 10 individuals. At the Cascadia Hotel, there are 17 persons. At the Home of Football, there are 13 persons. Region Star, 58. And within the Hilton, related to the CPL program, there are 170 persons. If Prime Minister, you would just permit me to ask Dr. Hines to give us a little brief update in terms of the contact tracing thus far. Dr. Hines?
Thank you, Dr. Parasram. Honorable Prime Minister, honorable ministers, colleagues, members of the media, members of the viewing and listening public. To add to the information just provided, what I'm going to do is just summarize some of the key findings around the contact tracing activities to date. What we have found is that the majority of the positives that we have been getting back so far are those that we've been identifying as we actively and aggressively chase contacts of persons who were confirmed positive. We have a lot of community-based surveillance beside that going on, and out of those who do not have a known or defined contact with a positive case, we find that the rate of positives in that group of persons is, of course, much lower. So we are aggressively contact tracing and testing outwards in the contact network and finding new cases, having identified persons as contacts even before their results come back. These persons are quarantined, and we're quarantined out to 3 levels, 3 degrees of separation out, which helps to contain the potential risk of transmission. What we have noted is that the transmissions that we saw between cases and primary and secondary contacts were in particular settings. Again, within the household setting, we saw that there was higher risk of transmission and a fair amount of super spreading events. A fair number of super spreading events were noted among persons that had contact with that bar setting. At least 2 or 3 bars so far have been implicated in the spread from one group to an apparently unrelated group of persons until the history of where you had been, what you'd been doing in a given time frame had been fully elucidated. So we're seeing where bars in particular contribute to that. The school setting, again, where students are close together, if there's an actual case within a classroom setting, we did see where that happened, that there were onward transmissions. So we're identifying where the highest risk of onward transmission is as we get more information on the contact tracing. We will continue to trace and to chase and to test as required. And so far, the work that has been done has given us a pattern that gives us some confidence that we're finding the people. At this point, I'd like to turn over to PM.
Thank you very much, Dr. Hines and Dr. Parasram, for your morning's update. Before I bring the minister in, I just want to do a brief review as to where we at with respect to our national response to COVID. If only to say that what we have done at the beginning still serves us well at this stage not being in the end, maybe in the middle, but we don't know where the end is. But the things that we have done at the beginning, as a small country, our perspective is the country of Trinidad and Tobago, 1.3 million people, is about the size of a medium-sized United States city, the size of a large European city in some instances. But 1.3 million people is about a size that we can do things that are not as easily done in populations of 300 million, 200 million, a billion, and so on. For example, the confidence and the effectiveness of contact tracing after an early lockdown and a closure of border, giving us the kinds of results that we got from those initial actions, allow us not to be exercised only by the number or the numerical change, but also by the system that we have in place to respond to changes in numbers. And what Dr. Hines would have said to us this morning, what we glean from that is that wherever there is an instance of confirmation of an infected person, our rings around that, our contact tracing, our finding people, our testing and get results, and quarantining of people who have been exposed to such person, the ability to do that and to do it with a fair amount of confidence allows us to manage the risk that we are, because there's nowhere in the world where there is no risk. There's no country in the world that can say we have no risk of COVID. And since the virus is not yet open to be controlled by a vaccine and also by treatment of infected persons for eradication within the person, we are still working with and learning from our experiences. In Trinidad and Tobago, our experiences have been relatively good, but we are still among the people of the world who are respecting this virus for not knowing the end game and not having a vaccine. So therefore, what in effect we are engaged in at the level of the national, and I would say the Ministry of Health, the Ministry of Education, the Ministry of National Security, the Ministry of, for all the ministries, the government, the people of Trinidad and Tobago, is a management of risk. Because if this situation that we are in now continues as it is likely to continue into months, and I don't know how long beyond months, until a vaccine is found to vaccinate the large population of the world. Basically, What we are required to do after the first reaction is to live with the virus. Some people are living with it in an uncontrolled way. There are countries with far more resources than we have who are not even attempting to do contact tracing. There are some countries who are taking the position that, well, we would do fast testing and people who are infected stay away, those who are not infected move on, and we just let it work out that way because the numbers are too large to try contact tracing around every person who reports. You're getting 10 or 15 or 20,000 persons per day in a country. To do contact tracing around them, the logistics of that is not the same as ours. In Trinidad and Tobago, we have in place a system, we have in place a structure, and that structure is working well for us. So while you would have heard about increase in numbers, as the Minister of Health would have said a couple of days ago, there's no raging virus in Trinidad and Tobago. The virus is not raging out of control. We are able to identify, pick up. We know that the virus is in the population. As it rears its head, we are able to trace, and so far, the majority of the cases and the numbers of increase that you've mentioned are people who we have found the contacts. So we know how it has happened, and as long as we are able to be in that position, we are in a relatively good position in terms of managing risk. And that is why I do not want us as a people to ask for panic reactions, because we never panicked. We took firm decisions using the science and the data, and we continue so to do. We continue so to do. And of course, if there comes a point where we believe that the risk requires a certain response because doing the same thing that we're doing is not sufficient and we need to do more, then at that point, we'll make those decisions as we made in the beginning. But now we are not there. But there are some things that we have been doing which has increased the risk that we are not comfortable with and we would have now. If we want to keep in the place that we have been, we know what we have to do if we want to reduce the risk in an area where the risk appears to have raised its head a little above where we want to be. We had our children home for a number of weeks, away from school, away from mixing with national population, traveling to school and so on. We understand the difficulty in getting children to stand within the protocols as accepted at the school environment, especially small children. But we also had the requirement, as we said, this is about life and livelihood. And we also could add to that educational progression. So life-wise, we stay home, we stay away, we follow a series of protocols, some of them looking simple but effective, and others might be a little more difficult. It had serious economic fallout for us and so on. We did that. And then we felt a little more comfortable as the numbers became stable, and we brought our SEA children out to prepare themselves for an exam that's important with respect to the movement of our children in our school system. So we had our SEA children come out. The teachers asked for, and other stakeholders asked for preparation of those children, not just throw them into an exam after they were home for 3 months. Bring them out and reacclimatize them to the school environment, get them mentally prepared for their exams, and we set the date as August 20th. And the children have been out there. But we got some results where we've had to do some close quarter monitoring of some of our schools. I think 11 of our schools had to be closed because there were instances of some of our children being exposed. And I think we have 9 children who have confirmed. We have 9 in the country. There are 9, 4 from the SAA group and another 5. We don't want to live with that as a high-risk area, even though we want to get the exam done. And what we met yesterday, and we went through the data step by step, line by line, and we came to the conclusion that we would not continue with that experiment of bringing those SEA children out. The decision that I've taken is that we will discontinue at this stage. From tomorrow, those children will not go back out to have classes at school. and we expect that they will do at home what they were doing before, and wherever your parents are able to help your children in one way or the other, for the next 2 weeks, we ask you to pay attention to your children and to make whatever contribution you could to their preparation and to calm them and have them ready for the exams on the 20th, because we will remain committed to having the exam on the 20th. So barring a disaster of some kind, like an explosion, which is not anticipated so far, our management has been such that we have not seen that, but we are not in a position to say can't happen. If it does happen, then we will have to react to that. But as of now, given what is happening now and what is anticipated would be the position by the 20th, we stay with the exam. Because the very fact of having the exam firming our minds and firm date, that contributes to the mental stability of parents and students. So let's hold the line and get to that exam. And I want to appeal to the public. If you want to comment on this matter and to help with this matter with our children and other situations, just please do the other things that are required to be done. Not just talk about closing down the school and going back on the lockdown, and all that is just talk. We're not going to operate because somebody says so. We're going to operate based on what the data shows us. And you don't want to be the one, the typhoid Mary in our population, walking around without a mask, coughing and sneezing for people in the air that you share. If you wear your mask, you will be making your personal contribution. If you don't congregate, you will be making your personal contribution. If you do what we say, let's all behave as though we are the person carrying the virus, and therefore we don't want to hand it off to our neighbor or associate, you're making your contribution. And if we do that as a population, we will be suppressing the opportunity for the virus to spread in our small 1.3 billion people, and not end up like other people where the virus is spreading uncontrollably and there is no system to control it, and our methodology would not work there. Our methodology is working, and as long as we cooperate at the personal level for the national policy, we expect that we will be in control of this situation. I'm a little disappointed when I heard yesterday TTUTA calling on teachers not to report for work as a decision of TTUTA in advance of any decision made at the national level. When we say we are all in this together, we mean everybody. And any decision made is made for everybody. And it is not helpful if persons in leadership positions believe that they are not going to accept what the country is doing because they are prepared to protect themselves better than everybody else. Especially when at the personal level, we're not seeing that commitment by some people where it is required as the protocol to deal with the virus. Because if one group takes that position, because it is what they have to do to protect their segment of the population, what if other leaders do that? Suppose the nurses union say our members are exposed to the actual viral DNA in the hospital, and therefore the hospital wards are dangerous, and they call on their people not to go out. Suppose the police union does that. Suppose the TNTech or the WASA workers do that. Then the whole thing will fall down. So this my way or the highway is exactly what is going to derail our effort, and I'm just asking, while not condemning anybody, I'm just asking that we all work with the national protocol. It has worked for us so far, and we have every confidence that if we work with that, we have a national system in place. The Ministry of Health is giving us data, which is the true data, which is the collected data. The systems are working. We're asking the population to cooperate with our investigators, because your little bit of information, which might seem to be unimportant to you, is in fact vital to the system. Who you've been with, where you've been, and so on, so we could trace any movement of any person who was exposed. That is what is going to give us that edge and that advantage. And all of us are exposed to some element of risk, because this virus has created a non-risk-free environment for all of us. The doctors are at risk. The people who handle the patients are at risk. The people who clean them, they are at risk. The people who secure them are at risk. Everybody is at risk. So no group should figure that I am not going to take any risk. So therefore, I dictate that I stay away from it. And of course, if we create a model that is unsustainable, there's going to come a point where we see the folly of our situation, because we are exposed now with the children in the way that I've just described, if we say any exposure, we shut down the country as far as the children are concerned. What if the situation remains like this for another year and a half, where the odd child here and there is getting this virus, brought home to him or her by a parent? Are we going to say that we're never going to open schools again? We're going to open it with some element of risk control and risk management. And we would only go back to the very difficult decisions as last resort. But more importantly, those who are monitoring and managing the situation, there are points along the way, there are conditions that we have to meet that would require certain decisions to be made, and those will be the best decisions. For example, if the numbers that we mentioned, the very same numbers that were mentioned here today, if they were numbers that we had no idea what they meant in terms of who infected whom, you might have had a different decision from me this morning. But because we have been able to track who has been infecting whom, we say that we are in some element of control. So a number by itself doesn't mean all that it could mean. And it is only when we operate in that way, guided by the science, the collection of data, high-quality data, the analyzing of that data without agendas. And that brings me to a good point, which I'll come back to later on. With respect to the reopening of schools, which is the next question that will arise in the context of this conversation, we have said at an earlier time that schools will reopen. I think it is very early we said this, in the first week of September. We are now in the first week of August. That decision to reopen is a month away. We are not going to make a change on that date today, but we will tell you that we will monitor it for another week or so, another week or 2 weeks, and based on what comes up during that period, we will confirm that date or we will review it for a change. But as of now, we leave it the way it is while we look at what's going to happen between now and the next 10 days or thereabouts. If it turns out that our national condition is such that the level of risk that we'll expose our children to in the first week of September is too much for us to accept, then we'll adjust accordingly. So that is the position with respect to that. And with respect the other children, the exams are over. I think there are only a few children have orals to do, which is not a large population of them, and of course we expect that those who are handling them will follow the normal protocols of spacing them out, and that is not going to be a problem. So our non-SEA children would be out of school in a matter of a few days. I think the exams are later down this month, so they will focus on that and get that out. Spanish and French oral exams, that's all that's in the system. All the others are completed, and so it's just the SEA children to withdraw them from the classes at this point in time and have them being prepared at home for exams on the 20th. So that's where we at with respect to the handling of our children. With respect to the public service reduction, we have instructed that that reduction take place. That will reduce the amount of people traveling. It will also reduce the amount of people being in contact. Those are a few tens of thousands of people who would rotate Monday, Wednesday, Friday. And so you have like half of the public service out and things like that. So the government workers take the reduction. We expect the other people at the private sector stations, where I must say private sector businesses have been very cooperative. They've made a lot of adjustments. And when we look at the infection numerical increases, we have not seen any increases in those situations. That is a good thing, except, of course, our drinking friends, our liming and drinking friends. The biggest risk we are facing now in the population of risk in Trinidad and Tobago, having withdrawn the children from school, the biggest pool of risk is the liming and drinking and eating out at restaurants and bars. And I'm saying this to you now. We have had 1 or 2 instances of tracing that took us to those locations as anticipated, because we expect that element of congregation would give us some exposure. We did see some results like that. Fortunately, not too many. But bars and restaurants remain a threat. And we are doubling up our monitoring of bars and restaurants on a daily basis. And this morning, I have once again spoken to the Minister of National Security to speak to the Commissioner of Police, to speak to his charges, to enforce the law. Our protection from irresponsible minority people at bars, and I dare say, I haven't heard complaints about restaurants, but certainly bars. Enforce the law. There are laws that can be and must be enforced. There's no replacement model for that, because our protection depends on the law being enforced. And for people who are organizing parties and people who are going to parties and congregating, they are being irresponsible. They are threatening the national well-being, and I want to see the laws enforced to the limit. Otherwise, everything that we're doing could be put at risk. I could tell you, we don't want to have to go back to a situation where the numbers are such that the response to a health crisis is another lockdown. The last lockdown cost us billions of dollars. I could tell you now, if we have to go back to another lockdown, such billions are not available. So let's understand that. And the jobs that we have saved surviving that lockdown may not be salvageable in the next go-around. I just was monitoring the United States. I see restaurants, small restaurants in the United States are reporting that 25% of restaurants in the United States may never reopen. 25%. This is a $13 trillion business, 25% of which may never come back. And you could imagine the effect that would have on the jobs of people who work in what is in effect the largest employment area in the country of America outside of the United States government. So these are not joke things, these are serious things. And all you're required to do is to be responsible. If you're going out for a drink, be alert to who is close to you and in what crowd you stand. Because if you are in a crowd of more than 10 people, you may have to talk to the police, because you are in fact breaking the law and loitering. It is not a joke. This is how we are going to protect ourselves. This is one time when being small allows us to be meaner and more effectively managing a situation that is not being managed as well elsewhere. But we don't have to keep comparing ourselves with other people, because the virus will talk to us personally. So far, so good. There are things that we are doing. Between now and Saturday, we continue to monitor with a view to intervening if we have to. The Ministry of Health will have a press conference on Saturday, and then the next one will be a matter for the next government. Ladies and gentlemen, I expect that you are aware that there's a general election taking place during this pandemic. That is almost upon us. The campaign has gone reasonably well nationally. All parties, all individuals have been, we've run a campaign. We expect that it will be heightened a bit this weekend. There still ought to be no rallies, no gatherings. I expect that there'll be motorcades where people are going to be in smaller groups and safe in their cars and so on. I'm appealing to all persons involved in political activity to put the health protocols first, because the virus does not respect election campaign. And if you do lose and you're going to celebrate, please do so in small numbers. And if you win and you're going to celebrate, please do so in small numbers. There are to be no gatherings to celebrate, because the whole effect that we want outside of everything that we've done, do not congregate. Election victory or not, do not congregate. Well, that is as much as I would like to say at this time, except to, wish us all well as we go forward and try and wear your mask, be seen to be wearing it, not below your chin, over your nose and mouth, and follow, as I said before when I started out, what we chose to do in the beginning still remains valid now and gave us a good chance to go forward. And the virus is still with us. We are still in it. There are some people who believe that it is something of the past. In fact, we are in it now more than ever. And if we look at other people who are ahead of us on the international curve, many people who came out and thought that they had survived it are now having to go back in because they lost control of the situation. So far for us, so good. And if we behave in a certain way, we think that we might be able to escape having to go back in, but we certainly may have to adjust if the numbers go to a point where there comes a stage where our tolerance for a certain level of risk tells us that we should make adjustments, as we made a minor one this morning, but the monitoring will continue with great vigilance. So I would ask the Minister to make a comment now, and then we'll open to the floor.
Thank you. Thank you very much, Prime Minister. Ministers, Chief Medical Officer, Dr. Trotman, Dr. Hines, ladies and gentlemen of the media, the viewing and listening public. I just want to make two quick points this morning, one about testing. At Wednesday's press conference, we went over the whole issue of testing and the protocols that Trinidad and Tobago has been using for testing. Dr. Tedros, early in this pandemic, said two things which we in Trinidad and Tobago should follow. One, he said the issue of COVID should not be politicized. He said that clearly. And two, he made a comment about testing where he said, test, test, test. But that comment was, again, taken totally out of context, especially by local aspirants to high political office. When he said COVID should not be politicized, he was making the point that if we are to beat COVID, there needs to be solidarity, political solidarity, social solidarity. And when he said test, 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 those three words were taken totally out of context because nobody focused on what he said after. And I played the clip again on Wednesday. He said, test, 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 test all suspect cases, isolate, trace, and treat. Local aspirants to high political office have taken test, 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 and they have forgotten the rest of the narrative. And we have been following WHO's guidelines as enunciated by Dr. Tedros from day one, where we test all suspect cases, especially if you had a travel history in the early days, signs and symptoms. Then we relax that in the second phase of testing, Dr. Parasram, where you did not have to have a travel history, but if you were symptomatic. And then we broadened it as time went by. But we always held true to the dictate or the suggestion, test, 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 all symptomatic cases, isolate, trace, and treat. And no matter how we say it from these platforms, there are those in society who, political aspirants, who continue to try to bore holes in our WHO protocols of testing. So I'm hoping this statement again clarifies our position where we are following WHO's policy of how we test. The second thing, Prime Minister, very briefly, we are currently at 40 persons in Cora. I have said publicly that as Minister of Health until Monday, that we don't go to full capacity in any of our health facilities. We try, and this is the figure I gave for infectious disease, we try not to cross 75%. So we have 35 more spaces in Cora out of 100. Point I'm trying to make, as the Prime Minister said, if a minority of the population continues to behave in a particular manner, we will reach that 75% at Cora very soon. We still have cover, but the point is we don't want to overwhelm the system. We don't want to test the system. And I want to make a final appeal. Think about the risk you are putting doctors and nurses at. Think about the human aspect. Our doctors and nurses at Cora are already under some stress. Correct, Dr. Trotman? We don't want to put our healthcare workers under stress because of irresponsible behavior in certain establishments. Think about what you are doing to capsize the whole thing by irresponsible behavior. So the 2 points, we are following WHO guidelines of testing suspect cases. We always have been. And please don't endanger the lives of our healthcare workers. Don't test the parallel healthcare system unnecessarily. We have capacity, but we want to keep that capacity for genuine cases. Genuine cases, not cases because we drink an alignment. Thank you very much, Prime Minister.
Let me just say that with respect to our repatriation of nationals into our mandatory quarantine system, which is another one of the legs of our stool, that mandatory quarantine has worked very well for us. Had we allowed people to just come in and quarantine at home, you and I know what the outcome would have been a long time ago. And that mandatory quarantine being part of our parallel health system arrangements, we have recently added another location. We just got Paria Suites in South Trinidad, additional 64 rooms, which will allow us to bring in some more people. But when you bear in mind that basically all the other rooms are filled with people who are waiting or are in transit through their quarantine period, you got to bear in mind that we also bring in people from areas that are of huge concern to us. This morning I saw the United Kingdom being mentioned as the area in the world with the highest death ratios. The highest death per capita is the United Kingdom. That's one of our contact zones. And the United States, of course, is breaking records with respect to the number of persons who are infected. And also Florida, the nearest part of the United States to Trinidad and Tobago, which is also one of the heaviest areas. So we have these challenges. But in the next, today, is it today? Saturday. By Saturday, we're bringing in a plane load of people from the United States, probably approximately 100 who have gone through the system and will be brought home as we're trying to bring people home in a managed way, in a careful way, where their arrival would not in any way increase the risk that we are living with. And we continue to do that, and these trips will continue as we bring people in from the various locations. And so Paris Suites is now added to the location where quarantine is going to take place, and we continue to make full use of the other areas that we have identified and which we have been using. Where we at now is that if we don't manage it the way we're managing it and just leave it to the weather and the sun, the numbers will just explode because we don't know who's going to go where and do what. But maintaining a mandatory quarantine for those who are coming in and tracing down contacts, that's the hard job that's been done by the Ministry of Health. And therefore, we expect that we would manage the numbers. And it's likely that we'd see some addition going on, but not a raging, how is it, Minister?
A raging.
That the virus is raging in Trinidad and Tobago. We've kept it from that, and we think we are on track to keep on being able to say that. So if you have any questions, and now is the time.
PM, may I just make one point, please? Ladies and gentlemen, I said earlier, I need to clarify it, to save our spaces for genuine cases and not cases arising out of bar activity. We are bringing in 100 persons this weekend. When we brought in the cohort from the Costa Favolosa, which was 68 people, I believe, 71% of those people turned positive on us. We have to assume at health, and this is how I calculate it. I have to calculate, what if 100% of those people coming from the United States turn positive on us? I have to have space. So if 100 people, let's say 75%, 75 persons turn positive. That means Cora becomes full. I have no more room in Cora. It means Couva, I will have to start to ramp up Couva. As we bring in more and more people, these repatriation flights, those are the genuine cases I am talking about. And then when I add that to the risky behavior, and in the back of my mind, I have no idea how much cases I get from risky behavior. And that is the problem confronting us now. And the problem could be alleviated if Trinidadians and Tobagonians just ask themselves, does the bar activity, is it worth it? Let us save our spaces for where it is genuinely needed. Thank you, Prime Minister.
Yeah, so let's have questions now, if you have any.
Good afternoon, Prime Minister Babita.
Yes, secondly.
Yes.
Good afternoon, Prime Minister Babita Gopalchan from CNC3 News. I trust that you can hear me properly.
Yes, Bevita, I'm hearing you, but I'm not sure if the viewers and listeners are hearing you. So
I'll
if you
speak
can,
a little louder.
you know, I like to ask you to raise your
Right,
voice,
I'll
right?
raise my voice.
Thank you very much.
All right, so Prime Minister, at any point in time during your meeting with the health officials, was it considered to reduce the hours of these bars or to clamp down on them in any way?
We consider everything. When we meet, everything is on the table.
What's the rationale for not taking such measures?
Because it's not necessary at this stage to give us the level of risk that we're working with. Bear in mind, the best thing that could possibly happen is for all of us to go home and stay in a room at home. All, including the essential workers. But then you start to work backwards from there. We really have to have electricity. We really have to have water. We have to have the police on the street. So from day one, even before we knew what level of impact the virus was going to hit us with, we dictated a certain amount of people to come out as essential services. And of course, the number one essentials were whom? The healthcare givers. We didn't say that, they're going to have to stay home because they'll be at risk. Every nurse, every doctor, every attendant on the ward, every person going into the hospital compound, they were at a risk that we are prepared to take that risk. So there isn't a perfect environment. When we went home, we spoke about saving lives by that action, but we also said we got to protect livelihoods. So as we make changes, right? Lives and livelihood, those are the two considerations. And if there's an action that is required to be taken, it's taken in that context. So when we meet to discuss the data is sacrosanct. And of course, the understanding of the model that we're using. You may recall when we started out, before we had our first confirmation here, the minister was talking about the model from CAFA.
Yeah.
We were trained on that. CAFA had models as to what might happen and what to expect when you get your first infections. And those models were what gave us an idea as to what level of risk we are going to expose the population to. And when we took the decision to do that early shutdown, or also to do the cut off of our contact with China, and to cut off our contact with some specific countries, it was all of that decision-making that came into there. So when we meet to discuss, in answer to your question, nothing is off the table. But then we decide what action do we take now, given what data we have and what the data is saying to us.
Mr. Prime Minister, I'm hoping that you could update us on the matter regarding financial assistance for nationals who are abroad and unable to come home. Has this started yet?
The Ministry of Finance got the approval, and it's not, let's get this very clear. It's not, we're not going to mine anybody abroad. There were some people, individuals, the odd individual here and there, who had left home, who had gone abroad, and by virtue of not being able to come back within the schedule that they had set themselves by way of their ticket or whatever else, they were finding their resources being depleted and they were becoming destitute out there. We sent, or the Ministry of Finance was authorized to send to London, Washington, New York, and I think Miami, $200,000 for the officers there, the person in charge, to make relief available to genuine cases of hardship, to that category of person who had left home, who got caught out there, and can prove that in some way, and now would have used up whatever resources they got. So a small amount of money could have been made available while they make their way through the repatriation system. So that is as much. It is not to be made as though we have now decided to fund those who are out there and want to come home. It is just humanitarian, as humanitarian can be, with a logistical understanding of what that means. When we had the same problem with the children at university, we did the same thing. We sent some money to the campuses, and we asked the principals to make sure that the students who, in that qualification, could get some sustenance until we could bring them home. And that worked reasonably well, and we got our children home. So, yes.
Mr. Prime Minister, Urvashi from TV6. Now, you said the virus is not raging. It may not be raging, but within the past 15 days, we've recorded some 58 cases. It started with case 139, about 1 a day, then we rose to about 5. Sunday was 9, yesterday was 12. Given that you did mention, and it's unlikely we'll see you again before the election is 5 days away. Let's just say worst case scenario. What is your threshold for postponing the election?
The threshold for postponing the election is a situation that the virus is out of control or is likely to be out of control in Trinidad and Tobago. That threshold is not met and is not anywhere near us. The numbers you have mentioned, I tried to explain a while ago. The number by itself is not the whole question. Is where those numbers came from. All that increase between 139 or 159 or where it is to where we are at. We have been able to identify most of those, and the ones we haven't identified are under active investigation. We are not seeing, it's not to say, well, the country is sick with virus and they're running to the hospitals and turning up there at the wards. We're not seeing that. So that tells us that the numbers that we are confirming are in fact probably the best expression that there is in the country. We, at the GP level, we're not seeing a large amount of people coming and presenting with COVID symptoms. And the proof of the pudding is in the eating. If we were underplaying those numbers and people were ragingly sick out there, they will show up at the hospital and at their doctor's office. That's not happening. So that is why we're saying we are confident that we have a good handle on it. But we are not going to expose ourselves to a situation where it can get out of control and then there'll be a genuine case for the election to be postponed. We are not there yet, and we don't expect to be there in the next how many hours that the election is away.
Allow me a follow-up. Of course, the election day, Monday, it involves a lot of mobilization. We see vehicles picking up persons, taking them to vote. I mean, one polling division may have as many as 600 persons coming in. What will happen? What do the models say? What will happen 2 weeks after the election?
The models say that once we follow the protocols that the EBC has set out and that we set out for the nation, the activity of polling is not any extraordinary activity. As a matter of fact, taking out half of the public service from coming out to work is more effective than persons in a line 5 or 6 feet apart going to vote. So we are, in fact, doing our business while the virus is among us. But the level of risk, you go to some business places, they won't let you in until you sanitize your hands and sanitize yourself. You go to a place to eat, you will see it there. So we are living with the virus. And one of the things we do when we are alive is having an election. Very important. And I hope you'll go out and vote and don't use the virus as an excuse for being a non-participant.
But Mr. Prime Minister, as you mentioned,
I didn't ask you were going to vote for your version.
If you will allow me another question, do you recognize that there are some persons, some members of the electorate that will be sort of cautious and they may choose to not go to vote because of that very threat of the virus? And that may impact results.
People choose not to vote for all kinds of reasons. I think the people of Trinidad and Tobago are sufficiently responsible. If we have not taken out one person, we haven't lost one person yet from our senior citizens' home, right? I would be very surprised if anybody goes to those homes to take out anybody to carry them to a polling station. I expect that we'll conduct this election without them. And the reason being that nobody wants to trample on their rights in the Constitution. But because they are so exposed, this is the pandemic election. I see people asking for a postponement of the election. Let me just tell you, I know my country very well. If I was the person who had asked for a postponement of the election, you would have had crowds exposing themselves to congregation to oppose that. I made sure I was the last person to even think about that because it was not necessary. There are a number of countries that conducted the elections and it was not a result of virus or no virus. There are protocols to be followed. And once the EBC protocols are followed at the polling station, once the police enforces the no loitering, no congregating in public places, because in any case, there's a limit to what the state can do, you know. Because if in the backyard, you and your neighbors come together to have a party, or you sneak away and go to a fete while the rest of us sleeping, and 200 of you irresponsible people go to have a beer in a fete in an enclosed environment, the most I can recommend for that is a small dose of something in a closed place called a jail. But of course, you know, the last thing we want now is to be picking up people and having other people to handle them and process them and prosecute them. Don't worsen the situation. Because that's what it is, you know. To prosecute people for not wearing a mask requires a body of people to carry out the enforcement, you know. So we just have to behave properly. That's why I keep enforcing that it is the personal responsibility that is taking us through this situation. And as of today, the postponement of the election is not on the cards, and normal people who are ambulatory could go to the polling station and, of course, do what you normally do. And after you cast your vote, don't hang around, don't loiter. Just and while you're there, follow the protocols, and we'd all be relatively safe doing that.
If I can be permitted, I have a question for the National Security Minister and one for the CMO. I'm not too sure who's going to go first.
Well, if you have one for the National Security Minister, you may go to the mic because I think he should be in a position to answer your very difficult question.
Minister Young, good afternoon.
Afternoon.
It's a question regarding the repatriation of nationals, exemptions. I understand that we have nationals in the Congo and some in Mozambique, Scotland, Australia, awaiting responses to their exemption applications. Are you able to speak to this?
We have nationals all over. So as you know, we've been doing them in batches and doing them very carefully. So added to what the Prime Minister and the Minister of Health just indicated, we actually have 95 from the United Kingdom who are about to make their way back as well. So there's a measurement. When we get the small sporadic ones, for example, on the African continent, as they come to attention, exemptions are granted. But again, it's a management exercise. Funny you should mention Australia. Australia is one of the countries that in the last week, various states have completely rolled back because the virus has risen and they've actually shut their borders, etc. So a lot of these countries, when you get the email, our nationals are actually saying that there's difficulty to leave the country and there are no flights there, etc. So in those circumstances, we are minded to grant the exemption, so at least they can go on the first available flight. So it is something we're conscious of, but as you know, over the past few weeks, we have been carefully managing the returns to make sure we don't overrun the system. And right now, we are at capacity with this 95 and the 100 plus coming from the UK and the United States. But we will look for those cases and see what can be done.
I'd be permitted to ask you just one more question. We are expecting, as the Prime Minister said, a plane load of persons from the US on the weekend. When can we expect another set of them?
So again, this is management, and one of the things we have to factor in is we're using this 14-day period. Of course, you have as well persons who are inside right now. Once we don't have a massive presentation of positives, which we are concerned about from the first plane load from the US, we will move quickly for the second. But we're also then looking at the second from Canada, another from the UK, and the ones that you've been mentioning. And so it's a constant management of numbers, but with the concern we don't overrun our quarantine facilities as well as our parallel healthcare system. Okay.
Can I just be permitted to ask Mr. Minister Young one question? Minister, I saw that some illegal immigrants were detained on Monday, I think 9 in Santa Flora. As it relates to illegal immigrants being this possible source of COVID infections, could you just give us an update on how that process is going? How many are currently being quarantined at the heliport, and has that been plugged?
Okay, so last week we had a big repatriation along with the Venezuelan government of persons from the heliport that cleared out the heliport facilities. Those 9 that were picked up in Santa Flora, I don't think were 9 off of a vessel, but rather persons, because the police have been instructed to engage in an exercise to ask persons for their Venezuelan migrant registration cards, and if they don't have them, we then hold them and we check the records, etc. So if they're in the system, we continue to work with Venezuelan authorities to repatriate them. Prime Minister, if I may just make mention, the flight that is on Saturday is actually we're also taking out the students who want to get out there. So we're filling a CAL plane to go up to Miami to take those persons up. That's the first one. And then we're using the opportunity to bring back 100 nationals. Thank you.
Good afternoon, CMO. Now that it's confirmed that we have the SCA candidates at home until their exam, are you able to speak to what's now to happen with children and group activity and sports?
Well, as we have said before, children and with the decisions taken today, children are and continue to be our high-risk group, one of the high-risk groups, in addition to elderly, in addition to immunocompromised, and as much as possible, I mean, with parental responsibility, we have to ring-fence those persons to prevent spread in those groups between each other and from outwards. So that's our main concern.
I have a question for the Chief Medical Officer before you sit down. Are you seeing total compliance and cooperation from the various contacts of the positive COVID patients?
In terms of quarantine?
Yeah, who are being made to quarantine at home?
Yeah, so the quarantine order is, in some instances, actually delivered to them by the police. So they actually sign the quarantine order. They have to stay in a particular location for a certain length of time. In general, there has been good compliance, and we have the full the backing of the TTPS as well in our committee and outwards, who have been working with the CMOHs to ensure persons stay at home. And I think the compliance rate has been very good. So that has been down to primary and secondary contacts for the most part, staying at home for the full duration of their quarantine time.
Mr. Prime Minister, a final question. How confident are you that you'll be addressing us here next week? And you'll be joined by the Minister.
I should ask you that, because you are very well informed, right? Yeah, I should be asking you that to comfort me that I'll be here on Tuesday. I'll just tell you one thing. I'm very confident that I'm going to vote on Monday, God willing. And when I vote, I'll vote wisely, and I know exactly what color I'm going to be voting for. So left to me alone, you see me here next week. And of course, I think, we lost a vote in Tobago we lost a seat in Tobago by 1 vote in 1984, I think it was. 1984. We lost we lost a Scarborough seat by 1 vote. But we did win San Fernando by 1 vote in Coquille, I think it was. So your vote is important to me. Right? Okay, thanks. Sean, I should acknowledge you as one of the first wearers of a mask in this room. And welcome back today with your mask. At least you were the one who, I remember you being teased in this room when you had your mask on, and none of us had a mask at the time. But over time, it has been shown, in fact, there are places in the world now where masks are mandatory and enforceable by, it has turned out that is one of the things that makes a significant contribution to the control of the spread of the virus. So you've been a pioneer here from this room. Thank you all very much, and we look forward to you staying safe over this election weekend. And national community, it's okay to go out and vote, but please follow all the protocols. Thank you very much.